స్టార్ హాస్పిటల్స్ బంజారా హిల్స్ తో పాటు ఇప్పుడు ఫైనాన్షియల్ డిస్ట్రిక్ట్ లో కూడా.
Keeping in mind that we wanted to deliver hassle-free and the best simplified healthcare experience for everyone here. And today we are at the status of delivering 5,000 plus tests under a single roof. Now that being said, we are located strategically across 5 locations in Hyderabad, which is accessible to everyone. Talking about the kind of infrastructure that we have, so we have a laboratory that is capable of delivering advanced reports which are timely and accurate. We have many departments here: immunopathology, immunology, cytology, molecular diagnostics, and genomics as well. Now coming to the radiology part, one of the most common things that people experience in a radiology is, be it MRI scans or CT scans or PET scans, they are required to stay still for a considerable amount of time without moving. And unfortunately, there are always movements there which result in issues in the scans that are coming. This results in maybe wrong diagnostics or wrong treatment. This is where we deliver what we promise. So we have the best in class MRI 3 Tesla machines which are AI assisted, and they complete the scan in less than 100 seconds for any part of the body. That basically reduces the noise, that reduces the issues that could result there. Similarly, talking about PET scans and CT scans that are available here, it's the first in South India where the scans are completed very quickly. So we have a 80 slice PET CT scan and a 160 slice CT scan. So when I talk about slices, it's basically the number of images that are being captured in a diagnostic scan. Higher the number of slices, higher is the accuracy of the diagnostics and better the treatment. And this is something that is first in South India that we're having here. Now moving on to the app. So the app has been, this is something that we wanted to do since quite some time, and today we are here to launch it. So it basically offers everyone healthcare at home. So right now, the moment one installs the app, we get 1,000 rupees credited into the wallet. Basically, everyone and anyone can access and experience healthcare in the initial launch of the app itself. That being said, there's also a 1 GB data space that is being provided to the customers of the app where they can actually store healthcare records. Similarly, there are multiple other advantages as well. Say, if someone's having a prescription and they're not really sure what is being prescribed by the doctor, we have our team of health experts here who actually look at the prescription that is being uploaded by the customer, and they advise the patient or the customer to what is the best report or the best test that they can get done on the app. So overall, this app is something new for us. It is new in the healthcare industry here in Telangana, and this makes healthcare affordable and easily accessible to everyone.
Chief guest for the event, Sri Jayesh Ranjan IAS, Principal Secretary, Information Technology, Industries and Commerce, Electronics and Communications. Sri Mamata Garu, Executive Member, SCSC, Dr. Sharath Reddy, Senior Interventional Cardiologist, Medical Hospitals, and Krishna Chaitanya. So, I think it's no better person than Sri Jayesh Ranjan Garu, the right person to inaugurate the app. I think this is the first of the kind where a diagnostic app, something equivalent to a food app, is being launched. And coming from the innovative city of Hyderabad, I think it's a proud moment for all of us. And I hope this app, which will be launched shortly by our chief guest, will be a great success. And I hope Sprint does well in the future. And the right person is here, such a hard-working person to bring Hyderabad into the world map. You could see the difference what Hyderabad has, the number of IT companies which have moved into Hyderabad, the new innovative centers. We had an opportunity to meet him once in his office. It's a lunchtime, and his meetings are on, and the parallelly is having lunch. Such a hard-working person. I think person opening this app, such a great person. I think it should succeed. All the best.
Sri Jayesh Ranjan IAS, Dr. Anil, Dr. Sharath, Sri Krishna Chaitanya, this Sprint Diagnostics team. Very good morning to all of you. I represent Hyderabad Security Council, which is focused on safety, well-being of IT/ITS professionals, who are about close to 9 lakhs, if I'm not wrong, sir, 9 lakh people in Hyderabad. Of course, we have been focused on safety of women, security, traffic, and other things. But what has been worrying us recently is the wellness, well-being part, the stress levels that some of our professionals are going through. And we've been looking at, most of these being lifestyle, stress-related diseases. And if apps have resulted in, digital apps could have resulted in creating lifestyle diseases. I'm very happy that there's another app that is being launched, which could be the answer. And I hope the Sprint team works very closely with Hyderabad Security Council. And of course, I represent one section of the society, which is the IT/ITS team. But I do hope that we'll be able to work together and bring the message of well-being and wellness to everybody. I congratulate the Sprint team and wish you all the best, and thank you very much. Yeah.
Thank you, ma'am. Now I'd request Dr. Sharath Reddy Garu, Executive Director, Medicover Hospitals, to say a few words.
Yeah, respected dignitaries on stage, and Sprint family members. Thank you for inviting me this app launch. And being a cardiologist, I'm a very techy guy. I keep using a lot of devices, and many devices. We have been launching new devices in Hyderabad. So I was just discussing. Congratulations to all of you for bringing such a wonderful app. This century is going to be a century of data, and data is the new science for new generation. And the most important thing is not just storing the data, analyzing the data and presenting data to clinician in an understandable way without sparing much time. And that is going to be the key in next couple of decades. So I think I'll try to share a few new thoughts, when I'm discussing with one of the guests, Mamta Garu. So you have to work on this data. See, whatever storage you are giving, that is going to be very, very important, because as a clinician, many times patients walk into my clinic and half of the data are being already lost. So, and this app, offering such an app which keeps entire data of the patient and giving a storage space to the patient, is going to be really, really useful to the patient. But what I think you have to do next is bringing, a graphical representation of all the data of the patient. I think that is where, you have to work, so that clinician can understand without much effort. And second is integrating, a lot of wellness apps, which Mamata was talking about. Yep, you can integrate all those devices into your app so that patient can hold. This becomes a single entity which can hold every aspect of the patient. I think that is going to really help patient, and most importantly, it helps clinician to make faster decision, accurate decision, and precise decisions. Thank you one and all for coming up with this, and I hope I'll see the evolution of this app to the next level. Thank you.
Thank you, sir. So before we call our chief guest on stage to speak a few words, sir, so when we think about innovation and technological advancements, we couldn't think of anyone better today to come here and grace our event and launch the app. So just a few words about you before you come onto the stage. Shri Jayesh Ranjan Garu is an accomplished IAS officer, Principal Secretary and Industries, Commerce and Information Technology, Department of Telangana Government. He is known for his dedication to public service and commitment to excellence, with a strong track record of successful initiatives and a passion for making positive impact in the communities he serves. He's a strong believer of digitalization playing a more important role and giving rise to new word applications in the different walks of life. His last few assignments have been in the industrial promotion sector as Commissioner and MD of the Industries Department, Secretary in the Tourism Promotion Department.
Greetings to all of you. Mr. Krishna Chaitanya, Dr. Sharad, Dr. Anil Krishna, Mamta Garu, members of Sprint Diagnostics, invitees, guests. Let me also congratulate the entire team of Sprint, also particularly Krishna Chaitanya Garu, for believing in technology. We know that technology is permeating every aspect of life, but still there are many people who are skeptical, who think that technology will add to costs, technology will not be accepted by my stakeholders, and therefore many people, despite so much of technology available literally at your doorsteps, are really missing the bus. But I see a completely different scenario here in Sprint, as Krishna Chaitanya Garu was explaining. The diagnostics facilities themselves are state of the art. He mentioned about the way MRIs and scans are recorded using the latest machines. He also spoke about the other innovations that has come in diagnostics, and to now offer another digital tool to help the customers, the clients, record their readings, make sense of their readings, provide those readings very easily to their consultants. Also, the point that he made that sometimes it is difficult to understand what the doctor is really recommending, and therefore provide expertise in figuring that out and guiding them to the right diagnostic procedures. So this is something very wonderful. I don't know who has developed this app, but I presume it could be possibly a local company. And if it is a local company, Hyderabad,
It's in-house, sir.
it's all been done in-house. So congratulations to the IT team, because this is something which always makes us feel very proud. 20 years ago, 25 years ago, Hyderabad was seen from a technology point of view as a city which only could offer back-end services. So your low-end kind of technology work, your payroll, your HR, your accounts, these kind of things used to happen in Hyderabad. And the advanced kind of technology applications like product development, development of apps, these things used to happen in Bangalore. But we all know that in the last 10 years, particularly since the new state of Telangana has been created, things have changed dramatically. We have lots of talent today who has come back. Lots of new companies have started their operations in Hyderabad, and some very cutting edge work happens here. So when someone says that a local team, an in-house team was behind the development of this product, development of this app, that really is a matter which is worth appreciating and worth congratulating. I would also make a couple of suggestions. See, we know that technological advancement is happening very, very rapidly. We should also try to recognize what are the other layers that we can load on this app. These days, lots of analytics is happening, what is called edge computing. So the moment data is received from a patient or a user, is it possible to do predictive analytics? Is it possible to recommend promotive kind of aspects of healthcare? We know that typically there are three aspects of healthcare. The one which we are most used to is when we fall sick or when we show some ailments, we go to a hospital, we seek a consultant, which is curative healthcare. But today, lots of people are realizing, particularly after the pandemic, curative, of course, is important. We need to have great institutions, institutions that are affordable, that are accessible, and offer the best quality resources to people who fall in. But as I said, after the pandemic, many people are realizing that it is also important to stay ahead of the curve, to take care of your health, which is preventive health care. How do you ensure that you don't fall ill? And Mamta Garu and Dr. Sharat spoke about lifestyle changes, lifestyle changes. But there is another aspect which is promotive healthcare. What do you do in addition, beyond what is minimum required of your healthcare requirements, to actually stay healthy all the time? So there are possibilities once you understand the patient, once we have multiple readings of the patient over a period of time, it may be possible to recommend what kind of preventive activities he needs to do, and beyond that, what kind of promotive activity he needs to do. See, we all know Not many people get it measured. I don't know whether you have this facility here or not. We have a chronological age, but we also have a biological age. So many times, many people, so you spoke about stress, you spoke about people who are not at a very early age. We have seen some kind of tragedies. In fact, people have passed away at a very, very early age of 30 and 40, and they were otherwise quite all right. But suddenly, while doing a treadmill or doing some physical activity, they just kind of lost their life. But had we kept track of what their key organs age is, how is the biological age, we could have realized that while by appearance they are 30 years or 35 years, but the biological age is maybe 50, 60, 65, and alarms could have been triggered. So how do you bring all these elements into diagnosis? This is again something which we need to collectively figure. And I'm very confident, looking at the way Krishna Chaitanya Garu is running this organization, relying on technology, believing in technology. These are some of the frontiers that he's bound to conquer. Hyderabad, as our minister keeps pointing out, is a wonderful city, a very unique city where biology meets technology, where life sciences meets data sciences. This is the life sciences capital of the country, in some ways capital of the world also. And this is also a very important technology hub. So now is the time to bring more and more life sciences related issues, healthcare related issues before the technologies, encourage them to give solutions, try it out, make it user friendly, make the experience, the UI UX of that experience absolutely world class, and then maybe roll it out. So any future endeavor of this kind which healthcare professionals want to try out, we'll be very happy to support it in the technology element. In fact, it's a nice coincidence that I'm here in this event, because just in maybe in 10 minutes, I'll be leaving for another event, which also is a healthcare related event, medical event. Today, the Association of Gynecologists who are using robotics for their surgery, they are having a conference. I have to speak there also, which again is something which I look forward to, because bringing more and more robotics, more and more automation into operation theaters, in surgeries, again is something which minimizes human error, which gives a better chance to the patient for improving his healthcare. So again, I'm very happy that this app is getting launched. But as I said, let this be only the beginning. Let us continue to evolve. Let us continue to bring more and more tech solutions within this app and in the rest of your diagnostics work. So my congratulations once again to you and your team, and thank you very much for inviting me.